on a graphical representation. This graphical representation on 33 parameters we do it. Okay, so in the graphical representation, what we do is, see, you see a green circle and you see a red color values. Those red color values are the values of the patient, and the red color values, green color values are the patient, are the normative data. So any acoustic analysis we do, we need to have an normative data of different population, different regions, which is required. Okay, it's not that if different countries developed a software and they have their own data, which cannot be compared to our data, because it depends on their height, weight, and ethnicity, and the kind of languages they speak. All those things, our voice characteristics will vary. So we need to have our own acoustic normative data. Okay, so this is a purely a normal sample how we get it in patients with or in a normal individual. In case of patients with voice problem, I think there is a delay in the video. Okay, I'll just move on the previous slide where we have depicted the how we get. Yeah, this is a curve where we see parameters, whatever you see it in a red parameters, those are the parameters which are elevated for patients with voice disorders. Okay, this particular patients, what we are seeing, it's a breathy voice component. Okay, so where they have the some parameters which are elevated. Okay, when we say breathy voice component, the number of voicing is observed. We call it as how many voicing, how many unvoiced are present in the waveform. So you see most of the things are noise related parameters are affected here. Okay, so based on this, we can say the person what kind of parameters really affected. It is pitch related or intensity related or noise related. So based on that, it would be helpful when we plan for voice therapy program. Okay, and the limitation with respect to this particular software is it's based on each phonation task. So okay, so if the phonation is, if you are phonating well, you will be able to get a good waveform or the good results. If you are unable to, if the graphical representation is indicating abnormal waveform, if I redo the task again properly, it will give normal graphical representation. Okay, so in this particular program, we don't see the graphical representation, we see the values. Okay, in EGG we don't see the values, we see the waveform. Here it's reverse, we only see the values, how much the values are we are getting. Okay, that's about multi-dimensional voice program. And yet another software we use for acoustic analysis, that's Doctor Speech. Okay, so it is marketed by Tiger Electronics. I'm here not to encourage any of the company products. Okay, I'm just giving you what all we have it. Okay, so what is the difference between Doctor Speech and other previously discussed softwares? Doctor Speech is the only software which gives information on both quantitative data and a qualitative data. So what do I mean by quantitative and qualitative data? The quantitative data means it gives in terms of a numerical representation of voice characteristics. In quantitative means it also gives information whether the voice is normal or hoarse, harsh, or breathy component. Okay, it gives in the form of a graphical representation. I'll straight away move on to the video presentation of this particular software. Okay, this is how it is calculated. The first one is how do we record. Once it's recorded, and it gives in the form of quantitative data. Quantitative data in terms of F0 and other voice related parameters it gives. This is what I was talking about, the voice quality estimates. Okay, the slides are coming up. It's taking time. Okay, what it gives information on hoarse voice, harsh voice, and breathy voice component. But still, it's not displaying. I'll just move on to the video presentation.
Okay, sir.
Yeah, explain.
Yes, sir.
Yeah. Okay. Once analysis is done, we do the assessment. So once the assessment is done, the numerical data are displayed. Once the numerical displays, this is what I was talking about. Okay, only this particular software gives information whether the phonation what we did it's a normal phonation or how is the quality of the person who's phonated. If you see here, it gives indication in the yellow color about the harsh voice quality that is within normal limits. Okay, then hoarse voice and harsh voice and breathy voice. Okay, so it gives a mild deviant parameters in this particular phonation task. Okay, also, in case of other persons with different voice characteristics, it will show it as deviant. Okay. So based on the with respect to doctor speech, what we can do is we can get information qualitatively and quantitatively. Okay. This is a breathy voice patient where we did the analysis. So if we can clearly see here, there is a force component, mildly it is affected. There is not a harsh component and there is a breathy component. Okay. So it will show us a deviant parameters here. So based on this, we can identify there is an quality which is affected for this particular patient without even before visualizing the patient's vocal folds, just by doing acoustic analysis. Okay, next one is about WAGMI. So most of the WAGMI parameters are covered in the previous presentations. So I'm not going to talk about what WAGMI and what parameters are assessed in WAGMI. I'm just going to give a demo on how WAGMI is using WAGMI software, how the voice characteristics are assessed. Okay, so it is an Indian product, okay, which is developed in Bangalore. Okay, so usually what happens when WAGMI will ask the patient to phonate R. Once the phonation is done, the sample has been saved in our hard disk. This is what I say an offline analysis. Okay, we don't do online analysis here. We do offline analysis. Once you save the data, and it will ask for several parameters for you to to select for you to do the analysis. Basically, you have to tell the system whether it's a male sample or female sample, that you do it in your analysis when we are doing analysis. After you do the analysis, the system will ask you to change certain parameters when you are doing the analysis. Once that's done, it will automatically move for further analysis procedure. I think the video is not playing. I'll just play the video again. Is it playing?
No, sir. Not playing.
No, it's not playing. Okay, I'll just go back and we'll play it again. Is it playing?
No, sir.
Okay, I'll do one. I'll just share the screen again. Yeah, it's playing now. I'm really sorry for the technical issues. Okay, what do we do is we save the samples. I was talking about the offline analysis. Once the offline, the data is saved in the system what we are using, it because we need to tell the system whether it's a male sample, female sample, and what is the age we are analyzing and what are the parameters we are interested in. All those things needs to be entered in the Agni software, and once that's done, it is automatically it will analyze and it will give us the information on the various parameters. That is parameters related to fundamental frequency, parameter related to intensity, parameter related, that is the fine parameters, that is we call it as jitter shimmer ratio. All these information are given in WAGMI. We also can analyze the conversational sample, reading samples, and speech samples. We can analyze using WAGMI. Okay, however, again, once you get the parameters, you need to clinically correlate the data, whatever we get it through WAGMI. Okay, just this is just a simple, demo on WAGMI. I'll straight away move on because Hemaraj was asking about how to assess, the nasal nasometer, that is the hypernasality. Sometimes if you come across patient with, hypernasality, because most of the time, as a part of voice characteristics, we need to assess the nasality also. Okay, most commonly the hypernasality is seen in patient with cleft lip and palate or patient who's having soft palate paralysis. Okay, we do have a software-based program to assess, quantify the nasalence, that is hypernasality. Okay, so again, what you see in the monitor, it's called a nasometer, a 6450. It's again by K Plantax. We do have a nasometer, in WAGMI and doctor speech. However, again, I told you it's a difference between an online analysis and offline analysis. What is the difference between a nasometer and the nasometer by K Plantax and other nasometers are? This again gives accurate, the validity of the equipment is important when we are doing any kind of acoustic analysis. So nasometer gives a perfect accuracy on information in nasometer. So that's why it's preferred to have a K Plantax nasometers when compared to other nasometers. Okay, so I'll just play the videos. Okay, so what do we do is we'll ask the patient to phonate vowel a, e, u, or any standardized passages. Okay, when we say standardized passages, what I mean is here we need to give, because we are interested in analyzing the person's nasality. So what we do is we ask them to do oral sentences and the nasal sentences, which is framed and which is standardized, and based on these sentences, we will be able to uh, we will be able to analyze whether the values what we get are within normal range or it is deviated from the normal range. And what we get here in terms of the graphs, this is called nasogram, where the lowest is 0%, the upper one is 100% of nasal length. Okay, so when we read a word, this is how it will be if we do it with a patient with hypernasality. And generally, it is ranges from 40% to 35 to 45%. That's how we get it, a normal nasometric score for different uh, different target sentences. Okay. This is about the some of the softwares which I am aware of, which is available at the Department of Clinical Services. So you have any questions in these softwares, you can ask me. I can clarify your doubts. And I wanted to give one small demo on Pratt. As you know, many of you know, all these softwares, whatever we have, needs to be purchased. Okay, and most of the softwares are starting from the starting range itself is 10 lakh rupees. Okay, so we don't get anything in free of cost. So some softwares which is available on internet where we can do a free analysis. Okay. Again, you need to know how to use the software. I'm just going to give a demo on how to analysis on few parameters using Pratt software. Can I proceed? Is it visible? My screen is visible?
Yes, sir.
Okay.
Um, have you shared the screen, sir? It's not visible.
Yeah, just share my screen just a
Okay,
second.
okay, sir.
Okay, just Amulya has asked me one question. Is there any studies on sensitivity and specificity of these softwares? See, most of the times when they release these softwares, it is already done. Once the sensitivity and specificity is done only, they'll release the software. Otherwise, they'll not be releasing or giving license for these softwares. Uh, for these softwares. Okay, what it is not available is the normative data are not available for some of these softwares in Indian populations. So those things can be considered when you are taking up these softwares. Okay, so let's go to my screen. Just share my screen. If my screen is visible, can you able to see my screen?
Not yet, sir. It's just
Yeah.
loading.
Okay.
Yeah, it's visible now,
Yes.
sir.
Yeah. So what I have done is I've just opened the Pratt software. Okay, PRAAT, which is available in internet. You can download it, okay, and you can install it. Okay, what I'm going to do is I'm just quickly going to show how to do some of the analysis using Pratt software. I already recorded and kept some samples. Okay, for your information, I'm just going to do how to do recording. Okay, if you have a laptop mic, you can just use a record mono sound. Okay, if you do a record mono sound, you will get one more window which will appear. Okay, you can just say record. Okay, it will automatically record. I'm just going to say record my sample. Since it's a live demo, I'm going to just record it straight away. Uh, okay, once you record it, you save list or you can rename. Okay, once this is done, you can just rename it as whatever you wanted. I'm just going to rename it as R. Okay, so I am interested to see what is my fundamental frequency, what is my intensity level. I also would like to see what is my jitter and shimmer ratio, and I wanted to know what is my HNR, that is harmonic to noise ratio in my voice. Okay, so before you proceed for the analysis, any voice analysis, you have to see whether the recorded data have come properly or not. Okay, so what I'm going to do is I'm going to see V1 edit option. Okay, so I'm going to see here there is a lot of noise because in my room fan is running. So generally, if you don't, without that background noise, if you record it, you will see, you will be able to get a clear waveform. So I am not going to consider this waveform because there is lot of background noise. Okay. what the window which I have opened, this is called a spectrogram. What you see here in the down black patches are called spectrogram, and what you see in the upper screen, that's called a waveform. Okay, so spectrographic analysis, it gives a lot of information about our voice. Okay, that is different. It is so basically energy representation of my voice quality. That is what it's represented in spectrogram. Okay, so I'm not going to consider this sample. I'm just going to open the sample what I have it previously recorded and kept from my system. Okay, I just opened the sample. I'm just seeing. See, can you able to make out the difference of the sample which is recorded with noise and without noise? This is without noise. What we have recorded, what I have recorded. Okay, I am in only interested in this particular portion. Okay, so I'm going to say uh, select uh, extract the selected sound which I am interested in. So I got the sample which I have selected. Then I am interested in this particular sample. So I am going to do analysis of periodicity. That is nothing but pitch. So go to analysis of periodicity. Okay, just run pitch. It gives some information. What you can do is you can straight away say, okay, you'll get one more curve here, that is pitch untitled. Okay, if you want to see how the pitch is analyzed, you'll get one more window. Okay, see here what you can see is the uh, pink color information, whatever is there. This is a pitch information for my sample. Okay, sometimes what happens, you have patients with pitch breaks, so which will be the pink curves will be reflected in other parameters, or you wanted to eliminate the pitch variations in this particular waveform. What you can see is you can just select and you can say unmute or unvoice. So it will be automatically unvoiced. Okay, here as far as this sample is concerned, there is no pitch elevation. We get a straight voice here. So what I'm going to do is I'm going to do again one more analysis for a cycle analysis. So I'm just selected the both the samples which I am interested. So point process TC, it will be there in the first one. Okay, once the point process is analysis, you can just see how the pictures are reflected in the waveform here. Okay, so once that is done, select all the samples you have analyzed. You'll get in the form of voice report. If you say yes, straight away you'll get what is your mean pitch. My mean pitch is 106. What is my minimum pitch? That is 103. What is my maximum pitch? 111. Okay, then your jitter values. Okay, all these jitter values are important for speech language pathologists because it gives cycle by cycle analysis. Okay, and shimmer values. Usually jitter value should be less than or equal to 1. Okay, if I see my jitter value, local here is 0.7%. That means to say I come within normal limit. Shimmer value should be greater than or equal to 3.80. Okay, if you see here my shimmer value is more than um, uh, you know that is APQ3 is 3.03. So which it comes within normal limits. Okay. Similarly, if you see harmonic to noise ratio, which is 15.9 1.92 dB, normally the HNR ratio should be less than 20 dB. Okay, so this is a simple one where you can do analysis, a voice analysis without having any uh, purchase software. We can do the analysis. But however, if you are establishing any kind of a voice clinic setup or you have a proper setup, you need to have other uh, software. It is preferable. Okay, because this gives similar information, but however, it's always better to go for online analysis than going for Pratt analysis. It is not that Pratt analysis you cannot do. Pratt analysis also you can do. It gives a reliable voice characteristics information. Okay, I also have one more sample to analyze. Okay. What we can do is I'm going to remove all these data. Okay, because it's only phonation sample we have analyzed. Okay, but sometimes we need to also see how the vocal folds are vibrating. So what some people would be interested to see is how the vocal folds, that is in speaking conversation, how it is. Okay, so what we do is we'll just do the analysis of continuous voice sample or speech sample. It's not reflecting, so I'm just there is some issue in my internet, so I will just share the screen. So I'm just going to open a sample which I have recorded already. So I'm going to see, this is the sample which I read. So I am interested only in this particular sample. Again, similarly, what you have to do is go to analyze periodicity, analyze pitch. If you give okay, you have to select all the three samples, whatever you want to do the analysis. Okay, so if you give a voice pitch, voice report, it gives information for conversational sample or speaking sample. Okay, the mean pitch you'll get and the maximum pitch. See the difference in phonation and the conversation sample. My mean pitch was, the minimum and mean pitch varied. Okay, the minimum pitch is 88.94 and maximum pitch is 59.7, which is an indication that definitely I will not have a pitch range of 597 hertz. Okay, so there may be some noise component which is involved when I was doing a conversation. Okay, so these are all the information. For this, you need to know the normative data of voice, voice characteristics of males and females and children. You will be able to do it for people who are attending other than SLPs. Usually, the speech language pathologist would know the ranges. Okay, that's about the live demo. If you want me to, if you have any questions, you can ask me. I'm happy to clarify. I'm really sorry for the technical glitches happen. Is extracting a voice profile from only one sample enough? See, usually you take the best sample. It's not that one sample. Okay. See, most of the time, what happens when we have a patient with voice problem, getting one sample itself, it's very, very difficult, especially if they are having a hoarse voice quality. Okay. So it's preferred you take, if you are going for a Pratt analysis, you make sure that your environment noise is not present. Okay. So if you have a fan noise, it will definitely affect. How I showed the live recording, you'll have issues when you are having extracting only one sample. So you need to have, because it's an offline analysis, what you can do is you can record it 3 repetitions and you can keep it, and you go to V1 edit in Pratt and you can see which is the best sample and you can select it. Okay, because hardly recording doesn't take much time. That's about Shakina's first question. Second one is the minimum pitch is the fundamental frequency, any significance with mean and median pitch. Okay, see, it's basically a statistical question. Okay, so when we say fundamental frequency or mean pitch, see, fundamental frequency is a pitch. It is an average of 5 cycle, 10 cycle. Okay, when we do the analysis, pitch analysis, what we do is it's nothing but a cycle per second. Okay, of the vocal fold vibrations. Okay, how many times my vocal folds vibrates and sound produced. Okay, so when we say mean, it means it's an average. Okay, the minimum is what is my lowest pitch and maximum is what is my highest pitch, and medium is again a statistical value. You derive it from mean and median. Okay, minimum and maximum, that is mean. Okay, you derive it from mean and standard deviation, you'll get a mean pitch. You should always consider a mean pitch. What is the mean pitch you have to consider? Minimum pitch is a pitch which the person can able to produce. That is minimum pitch, and maximum is what is his maximum, pitch which he is able to get it. That's what is minimum and minimum and maximum is. Okay. Does PRAD provides normative data? See, PRAD is an analysis software. Okay, you have to have your own data, or some of the institutional projects where they would already published the normative data, which are published in articles and journals, which is available. Okay, for example, if I have to say for normal, what is the normal normative data for adult normal? It's between 80 to 180, 80 to 120 dB, 120 hertz, we say. 80 to 180 hertz, sorry, 120 hertz for males. If we say females, it's 180 to 240. That's a pitch range. Okay. Similarly, for children, we say 240 to 340 or 380. These all established normative data for Indian populations. Okay. Okay, that's about the questions asked. And Amulya, continuing with my previous question, which is the most sensitive software among EGG, MDVP, and doctor speech? See, when you say most sensitive software, see, it's again based on what you are interested to analyze. Okay, what kind of analysis you wanted to do, based on that you can do it. For if you ask me, if you want to do the contact of the vocal cords, EGG would be the best software we can do it. Okay, and for fundamental frequency analysis, you can even use PRAT. Okay, that is more sensitive. If we have a financial constraint to have a software for clinical purpose, PRAT is good. If you want to have an institutional setup, you have to go for CSL with add-on softwares, because once you purchase CSL, you can do different kind of analysis. You can do a research projects using those softwares. So all are equivalent, I would say. It's based on your requirement. Amulya. If there are any other questions, I'm happy to answer. Yeah, when you say test battery approach is recommended, see, again, it's not a test battery approach. It's a test protocol approach. Okay, when you do for example, if I have to say AISH protocol for voice assessment, we would start off with a case history, your test protocol. Okay, when you say test protocol, yeah, I'll just come back to mono recording and stereo recording. Before that, I'll just clarify the test battery approach. Okay. So when you go for a test battery approach, we go for case history. You will be starting off with your case history. Then you'll go for your perception analysis. You should never forget your perception analysis when you are doing voice analysis. Okay. Either using graph scale, KP, whatever it's available. Okay. All are freely available. So you can choose whatever you want. Okay. Based on your time and based on what you are interested in. Okay. So your perception analysis. After that, you would be going for your, definitely you need to have your fundamental analysis, and your intensity related parameters and perturbation assessment is required for your voice analysis, because you would be not only seeing the patient, when they gave for first interaction. After that, if they recommended for voice therapy, these data is going to be your baseline data to show or prove that there is an improvement. Okay. So these all the improvement, it is required. Okay. So apart from these fundamental and fundamental frequency and intensity related parameters, if you are interested and you have a fund availability, you can go for electroglottogram. It is not available if not an intensity parameter sufficient. Okay. Apart from that, definitely you need to have indirect laryngoscopy. Okay, as they suggested the previous presentation. Okay. If the funding availability is there, I would definitely say you have to go for a stroboscopic evaluation, because stroboscopic information does give information on some of the functional aspects of vocal cords. Yeah, I think I am answered Amulya's question. The significance of mono recording and uh, stereo recording. See, when we go for a stereo, it's about the channel. Okay, it's always better to go for more channels and going for a mono recording. I just gave what information it gives. It's a double channel. When you go for a stereo recording, it gives a double channel. If you go for a mono recording, it's a single channel. Okay, it's always better to go for a stereo recording when you go for any kind of analysis. If you are going to go, or if you are going for any kind of a research paper, uh, planning for a research, you should always go for stereo recording with there is a something called bit rate with a 44,100 bit rate would be a good quality for audio recording, and it would be useful when you are going for an acoustic analysis. Yeah, I hope I have answered your question, Mr. Ajish. Is there any other questions? Please feel free to ask me. Is there any other questions? Is
Is
there
there
any
any
other
other
questions?
questions?
Okay. Thank you so much for the excellent presentation, sir. In spite of the few technical difficulties, I'm sure that most of the concepts were put forth very well. Thank you so much, sir. We would like to especially thank Ms. Sindhusha Chandran for the concept of worksheets and contributing significantly to the smooth conduction of the workshops. And now I'd like to request Dr. Vijayalakshmi Subramaniam, Professor and Head of the Department of Otorhinolaryngology, to deliver the vote of thanks. Over to you, ma'am.
Thank you very much, Dismi, and many thanks to Dr. Gopi Shankar for having accepted our invitation and been part of this summer intensive workshop on clinical assessment of voice disorders. So with today's session, we come to the close of the 3-day summer intensive workshop on clinical assessment of voice disorders, which we had planned in connection with World Voice Day. And today happens to be World Voice Day. The theme given for this year's Voice Day is Lift Your Voice. And all of us definitely have gained a lot and have lifted our skills in diagnosing and managing voice disorders. So this intensive workshop was planned by the Department of Otorhinolaryngology in association with the Department of Audiology and Speech Language Pathology. And this workshop was interdisciplinary because we had a large number of participants from the fields of electronics and electrical engineering, medical students, postgraduates, and consultants from otorhinolaryngology, and a significant number from the speech language pathology section. So I'm sure this workshop has fulfilled its objectives, and we are really thankful to all the eminent resource people who accepted our invitation and joined us despite their busy schedules. And we thank all the participants who joined us for being committed, and actually they have sacrificed their long weekend holidays, and they have joined us. Really thanks to all the participants. And on behalf of the organizing committee from the Department of Otorhinolaryngology and the Department of Audiology, Speech Language pathology. I thank all the higher authorities of Yenepoya deemed to be university for permitting us to conduct this workshop, particularly the Registrar of Yenepoya deemed to be university, Dr. Gangadhar Somayaji, the Principal of Yenepoya Medical College, Dr. M.S. Musaba, and of course my fellow colleague, the Associate Professor and in charge of the Department of Audiology, Speech Language Pathology, Mrs. Shweta Prabhu. I will be failing in my duties if I do not thank Mr. Hemraj Nayaka, the Assistant Professor of the Department of Audiology and Speech Language Pathology, who has actually planned every bit of this workshop. I thank all the postgraduates who have helped us by anchoring this workshop. I'm grateful to the Deputy Director of the IT Department, Mr. Rajesh Karkera, and all the staff of the IT Department for having facilitated the smooth conduct of this workshop. Thank you, everyone. Thanks once again for having joined this workshop. And once again, greetings to all of you on the World Voice Day. And I wish you all a very happy weekend ahead. Thank you again. Just for the information for all the participants, the feedback form will be mailed to you. There will be a Google form that will be mailed to you. And once you fill the feedback form, the e-certificates will get generated. So please give us your feedback. It is very valuable for us. By Monday, the feedback form will be mailed to you. Thank you again.
Madam, can I exit?
Yes, sir. Thank you very much for joining us.
Thank you, ma'am. It's nice meeting you. Pleasure.
My pleasure too, sir. Thank you so much.